Hello, I'm Kinsey Strine, and I'm going to be talking a little bit about the differences between Medicare and Medicaid in Ohio, and just a little bit about how they're similar but also different, and the different levels of them that there is, and basically just how to help your patients and help understand what people might be going through and why they might need these coverages. So to qualify for Medicare, you typically have to be 65 years or older. So Medicare is typically for the older individuals in the community and not the younger individuals. And or you could potentially have some type of disability to possibly be able to qualify for Medicare. And sometimes different Social Security and retirement benefits will automatically allow you to have these Medicare plans, which is definitely super nice. I'm not exactly sure how these which certain benefits it'll allow, but this is definitely very nice if you do have these benefits. And Medicare programs for will help cover hospital insurance, if you're paying for a hospital care that you had done, or prescription drugs, or if you're in a nursing home, it might potentially help pay for a little bit of that. And also any in and outpatient care that you might have to have. And it'll also help pay for certain dental and vision and hearing, if you're having issues with any of those and you go to the doctor's office. If you have Medicare, it'll typically help pay for all of this, which is definitely very nice. And this was found from the Ohio Department of Insurance article, and this was titled Medicare 101. And then to qualify for Medicaid, this is typically based upon your family size, your income, your age, if you have a disability, and kind of just any other health issues, kind of pregnancy. This program is typically made for the lower income families and individuals, but you also have to be a resident of Ohio if you are within the Ohio Medicaid program. And it basically will help cover ages 18 and under, and then also it can help cover people from 16 to 65, depending on if you have a certain disability, if you can't walk, or you have MS, or just something like that. It'll help cover that. And if you're 16 to 65, you have to be working, so it'll help pay for it'll help you get those benefits for Medicaid to help pay for your hospital visits. And this information came from the Ohio Department of Medical Medicaid, which helps individuals figure out their health insurance coverage. And Medicaid is typically a local and at state levels too. So the state administers them, and then with the federal regulations, and then the federal government will go through everyone that's trying to get on Medicaid and look at their kind of eligibility and what benefits they might be able to get with this, and also look at the different regulations and see if they do qualify. And in Ohio, Medicare and Medicaid are very similar, but they are also very different in many ways. So Medicare is the foundation for the insurance coverage in hospitals and for prescription drugs. But Medicaid will pay for services that Medicare won't pay for. So a lot of times Medicare won't fully cover certain hospital stays or nursing home visits. So Medicaid will step in and help pay for those as well. And from an article that I read, it was from the U.S. Department of Health and Human Services. So Medicare is only for 65 and older, but Medicare can be for any age, but typically lower income families that have little to no resources. And this just helps make sure that everyone will be able to help or pay and survive off of these benefits that they might be receiving. And these are very important for individuals of all ages in the United States, even if you don't have these services, it's very important to understand them. So if you're working in a hospital or like your family member talks about needing to be on Medicaid or Medicare, you're able to like help understand with them and help them process like what all it might entail and like what all they might have to do to be able to get these benefits. And it'll also help you for like your future, like once you get up to 65, or like if you have like a random hospital stay, it can help you like learn how to like pay for your bills if you aren't able to pay them out of pocket.